Welcome to our program today, and our topic of discussion will be Loma Verde Facility Foster Home. I have our guest today, the owners of Loma Verde Facility Foster Care, and it's located on the east side, and Juan and Teresa Ceballos. Thank you for welcoming us to your home. As far as your foster home is concerned, how long have you been providing services?
Well, for the adult people, it's our first experience, but we have a 13 years experience in foster children's care.
Okay.
And it's a pleasure to start with a new experience. My husband and I, we like to help people, and I would like to share our life and help people.
So mostly what you will be providing is a foster home for seniors in our community, correct?
Yes, that's right.
Okay. How long are you looking forward to this new venture in foster care?
Yes, we do. We are very excited about taking care of those older people.
And opening your doors to the public?
Exactly.
Okay. I know you've been getting a lot of support from one of your colleagues in the community, Angel Aragon,
Yes.
who has been in the industry for many years. Angel Aragon owns Anthony's Foster Home, and your wife operates another foster home, which is Desert View Foster Home, and you're located on the east side?
Yes.
I came into this facility today, and it is just very open. It's very user-friendly for seniors to come in and move in here immediately, and it's very open space.
Mm-hmm.
The rooms are also nicely decorated, so you're going to allow people, if they want to call you, to do a tour of the home and see the rooms. Is that going to be okay with you?
Yes, they can always welcome to our property and take a look at the house, and they can always call us at 915-288-2619.
What is the address?
1109 Loma Verde.
1109 Loma Verde on the east side, correct?
On the east side, yes.
And I think, how do you get here? Is it?
You take the I-10 and go north on Joe Bottle,
Okay.
and turn left on Rojas and right on Loma Verde. It's very close to the freeway,
Okay.
so it's very easy to go in and out on the freeway.
As far as the foster home is concerned, are you allowing also couples, husband and wife, to move into one of the rooms?
I think so. I
Okay.
don't see why not.
Okay. And also, because that's when sometimes you're going to find that, husband and wife want to move in together,
Yes.
and you want to keep them together. So I looked at the bedrooms and the rooms that you will be
Right there.
providing for the seniors out there, and they're very spacious. And also, we had talked about decorating the rooms if the families want to bring their own items, family heirlooms, furniture, and they want to decorate it the way it was going to be open to the way
Yes.
they want to decorate.
Yeah.
We are open for them to bring their own pictures, their own furniture, anything that they like. They want to see it, in their room. They always want them to bring it over.
Okay, thank you. Angel Aragon, I wanted to, since you've been in the community for a very long time, I wanted to ask you, what is the question about what is the definition of a foster home?
Okay. First of all, I want to thank Mr. and Mrs. Ceballos for allowing us to be here tonight. And concerning your question, foster home is a concept where people can live in a home-like situation without being in a larger facility such as a nursing home or an assisted living facility, have the comforts of a home and still get all the services that they need based on their individual needs, their health needs, and everything that pertains to the daily activities that they conduct at home. The idea of a foster home is to provide the families and the recipients a way of life that is very similar to what they have at home.
We mentioned nursing home and you mentioned assisted living. My first question to you is going to be, how is it different from a foster home different from a nursing home?
Okay, first of all, a foster home, as you can see here, is a home. In this case, the Ceballos are providing care in a facility where they live in. They are going to be dedicating part of the house to foster care activities and the other part to their living quarters. Now that's the first difference that you find in a nursing home. Nursing home is an institution. You have only people that are residents or patients in the nursing home, but they don't have the family situation that you see here. Now assisted living, it's more closely related to a foster home, but it still is an institution. You still have a larger amount of people that are being provided with care for the daily activities, but it still has a resemblance of a nursing home or a larger facility that doesn't even get close to a home. Now, a foster home, the idea is to, like I mentioned before, to have a family environment, because you not only see the home-like situation, you see family going about them, their families are welcome, all the activities are conducted just as if they were living in their home. So that's the big difference that there is between a nursing home and a foster home.
And is this considered a foster home the client's residence? Is that, as an owner, do you see it that way? That this is their place of residence?
This is their place of residence. Once you accept the person in your home, it is considered their home. They can bring in their relatives to visit. They can bring in their personal items, like Mr. Ceballos mentioned. They can redecorate the room the way they want it. If they want to have a particular arrangements of furniture, that can be done. And of course, their privacy is respected. Their room is their home. And also whatever is considered the general use areas of the house. So they can go about and use the house freely as if they were at home. The only limitations that you can see here is the health limitations they have. For instance, if a person is wheelchair bound, or if a person is in a bedridden, things like that, of course they're not going to be able to get out of the room. But still, the home itself will be considered their home.
Now, what are the services that the foster home providers will be providing? Are they going to be providing the meal preparation?
Meal preparation, personal care. They will get showered, they will get bathed, the room's cleaned, their clothes washed. They'll have time to watch TV if they want. There will be activities, whatever they prefer to do. If they go outside, like this home in particular has a beautiful garden outside, they're welcome to go out and do some gardening if they want to. There is a beautiful space up front if they have family members visiting, where they can sit with them, have a kind of a picnic out there if they want to. Those kind of activities, you know. The idea is to provide them with the needs they have on a daily basis.
Diet, we were talking about nutrition, so if they need, they're in a special diet like low sodium or a diabetic diet, will they be providing these type of meals?
Yes.
Okay.
The way it works is we work very closely with home health agencies and other institutions to provide them with what they need. And of course, we follow doctor's orders, nurses' recommendations, dietitian recommendations, and the experience that we have with people that have those kind of conditions.
Okay. Transportation to physicians, is that something that the foster homes provide?
That is provided, yes. However, I have to mention to you that when it comes to transportation to either physicians or family visits or any other programs outside of the facility, arrangements have to be made with the owners of the facility, because it's not a free service that is provided. Services outside of the foster home are not provided as part of the contracted services that the foster home has. But that doesn't mean they cannot be provided to the residents if they need to. Now, there is one thing that I have found out over the years I've been doing this. When it comes to doctor's appointments, it's probably best that the families handle that, because they're the ones that know the resident. They're the ones that know what type of conditions they have, how long they have had them, and what is the family history behind that. So we as providers, as we move along with the residents, we get to know them very well, but not as well as the families, and that's why there is two options that are given to the families. Either They allow us to take them to the doctor's appointments, or they continue handling that themselves.
As far as also, I want to go a little bit with the people that are in the taking care of the resident here. There's somebody in-house 24 hours, 7 days a week.
Yes, that's the purpose, to have someone that is trained, that knows what the services need to be provided as far as the guidelines, and that is familiarized with the resident in case there is any type of emergencies. And of course, that person is going to be available 24/7.
Okay. We talked about something that you mentioned earlier about home health, and I'm going to go into that as part of the skilled nursing. That is something that Medicare pays for at 100% in these type of facilities, correct? That if the patient requires or the resident requires the assistance of a skilled nurse for wound care or the management of their diabetes, for example, they are allowed to come into the foster home, correct?
Yes, that's one of the choices that Medicare gives the patient once they get to the hospital, for instance, and they want to make sure that the care is provided at their place of residence. Now, considering that the home health services or hospice services or any other services like physical therapy, for instance, will be provided at 100% in a foster home setting without any cost other than, I don't know, the co-pays that they have to the residents. And that's going to happen in any institution if they walk in.
On the question I'm going to ask is regarding home health.
Yes.
And again, tell me a little bit about home health, how it's going to benefit the client in a foster home facility or home health and hospice.
Okay, first of all, once the doctor decides that the person cannot live alone at home, they want to make sure that he continues receiving the services that they require. They'll write orders to continue with home health for physical therapy, for nursing services, whatever other need they may have. And that applies or follows the resident wherever they go. Even if they go home, they still can benefit from that. If they go to an assisted living facility, they benefit from that. Or if they go to a nursing home, they benefit from that. So it's something that generalized as far as the services provided from the medical point of view.
Since the resident has moved into the foster home, can a patient, if they've been here living in, for example, here at Loma Verde facility, they've been here for a year, 5 years, 6 months, can hospice come in here and if the patient says, I want to die, pass away here in my
Definitely.
Is that
since this
allowable?
since this is considered the residence, if it comes to that point, yes, it is allowable as long as the family and the resident are in agreement with that arrangement.